I like to tell women, don't define yourself by your AMH. Your AMH gives us some information, absolutely. It can give us information on ovarian reserves. So AMH is a hormone produced by the granulosa cells that surround the smallest, little, tiniest eggs. It's the smallest follicles actually in a woman's ovary are the ones that produce AMH. And honestly, we've been measuring AMH for quite a long time in our history of medicine. However, we haven't really tested enough women and come up with a standard of this is the AMH level that is in the normal range for women, or where women this age should be about X amount. So we really don't have this standardized, agreed upon levels of AMH. I like to tell women, don't define yourself by your AMH. Your AMH gives us some information, absolutely. It can give us information on ovarian reserve, so potentially how many eggs, and not the number of eggs, but the overall amount of eggs in reserve in a woman's body. It's not going to give us an exact number of eggs, and it's also just one little glimpse into that picture. And in order to look at the overall picture of a woman getting older and her biological clock, so to speak, or how many years does she have to be fertile, most likely, we like to look at other things, not just AMH. We like to look at FSH. So where is your FSH level? We ideally like that between 4 and 7. And if FSH is getting closer to 20, then we are concerned that maybe that woman is getting close to menopause. Not necessarily, but that's one thing that we think about. So we don't look at just AMH on its own. We like to look at AMH with FSH and also estradiol, because as a woman ages, estradiol can increase or decrease. So we're looking at her estradiol level overall. We're looking at AMH and FSH to get the whole picture of where she is in her fertility. We have seen women's AMH levels actually increase, and normally with aging, AMH decreases. And our ideal range is 2 to 4 when we're working with a woman. We like to see that range between 2 and 4. If it's above 4, don't worry, that gives us more information, and we'll look at other things. If it's below 2, don't worry as well. We've seen women with AMHs below 1 get pregnant. And we have actually seen AMH increase, which is really interesting. The belief, or the way I can wrap my mind around that, is we do have a certain number of eggs. We're born with a certain number of eggs, so we're not necessarily increasing the number of eggs a woman has, but we are increasing beneficial environment that the ovary is in, so that more of the follicles, these small follicles that produce AMH, they can show up. So we're just seeing more healthy follicles that are going to produce the AMH. Now, AMH doesn't necessarily mean that we have healthy, high-quality eggs. So just because you have a high AMH does not always translate to healthy, high-quality eggs.
If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.